Hey guys, I hope you're having a great week. It's time for our live. How's daylight savings going for you guys? I feel weird because it's like still light outside, but yeah, it feels good. Once I adjust, it'll be good. I had 2 pre-submitted questions, so I'm just going to go over those right now. We're a little early for this very reason. And then we'll get started. Just remember, guys, none of this is medical advice. I'm not a doctor, nor do I make any claims that I am. I'm a researcher and a nutritionist, and I'm looking at everything in the lens of nutrition and also hoping to empower you guys and inspire you guys to do your own research. So make sure you're talking to your necessary healthcare professionals and providers, and using common sense. The first question was, hey, wanted to add a question for the live. When I eat well-cooked potatoes or rice, I get a severe immune response and acne. I've tried having with fructose, but it doesn't seem to work. What else can I try? So tired of eating squashes. Thanks so much. This often is paired with like either fungal overgrowths or bacterial overgrowths. So if you're very sensitive to starches, a lot of times it's a mixture of both, since the starches really do tend to break down and feed bacterial overgrowth or fungal overgrowth. So if that's not resolving, you may have to deal with your fungal overgrowth or your bacterial overgrowth. I really have a preference towards like antibacterial and antifungal herbs. They're just kind of, to me, like you can do a very low dose over a period of time. And to me, it just feels a lot more comfortable. But some people opt to go more of an antibiotic route if they can get diagnosed with SIBO or overgrowth. So it just depends. But sometimes we do have to take extra measures to kind of get the bacteria down. That doesn't mean we can always restructure our whole microbiome until our metabolism is fixed. But in the meantime, getting some of the bacteria under control and kind of changing up the microbiome by either taking specific antimicrobials and or adding in some really like high quality specific strain probiotics can sometimes be very helpful and help us resolve a lot of our food issues while we're working on our metabolism. I can't be there, so if I may please ask here, benefits of phytic acid with lowering iron absorption, and is it true that our gut is actually able to break down phytic acids? My other question would be that I can soak wheat flour, I think, on a room temperature for how long? I'm not really sure what the second part of that question means, but remember, guys, there are many different types of phytic acids, phytates. Phytic acid is just one of them, which is pretty much the usually compounds found in like vegetables that keep us from absorbing all of the plant's minerals or possibly irritate the gut a little bit so that we maybe don't eat them again. With that being said, proper preparation oftentimes can make a big difference in the amount of phytates or phytic acid in a food. And then, there is some research from the research that I have read specifically on like inositol, which is interestingly is phytic acid, which a lot of people use to bind to iron. And obviously it's a very popular PCOS supplement. From what I've read in the research is that our body tends to adjust to phytic acid. So over the course of a period of time, we tend to be able to like resist the effects of phytic acid a little bit more and more. But that's just like my basic understanding. Remember that we've coexisted with plants for a period of time, and the context of our health matters. So when we're coming in a very depleted and impaired state, our diet may look a little different than somebody who has like really restored their metabolism. They might be able to handle a little bit of the phytates that are in their food with no problem. But if we're having a really hard time breaking down our food, it's probably not a good idea to add in more foods that are hard to break down. I hope that makes sense. Nutrition is not black and white, and sometimes we really like to make it black and white, and other people in like the pro-metabolic community like to make it black and white, which is why I tend to try to not use this like overarching term as pro-metabolic, like a pro-metabolic diet. Because what is a pro-metabolic diet? It's a diet that supports your metabolism. And yeah, typically people are eating like orange juice and fruit and sourdough and milk and dairy, but that doesn't always mean that that is going to support your metabolism specifically. So I'm starting to get a little irritated because I see people saying like, well, a pro-metabolic can make insulin resistance worse, or a pro-metabolic diet will make SIBO worse. And I'm like, well, I mean, it will express symptoms that are already there, possibly. That doesn't mean like it's a pro-metabolic diet. You might just be eating stuff that's not working for you right now. But that doesn't mean just like deal with it, fix the issues. How to take TUDCA with a meal, empty stomach. Can you also tell me how it can help? I personally take it with meals, just like a bile acid would be taken. Remember, like when we take a supplement, we're trying to mimic what our body would naturally do. Our body does not secrete bile acids when fat is not present. But yeah, that's how I take it. And it's meant to support bile flow. So some people will respond really well to bile acids. Some people like to do ox bile, which is a many different bile acids. Some people like to go a more natural route and do bitters, which help stimulate our production of bile acids. It just really depends on what our goal is, and also like our individual constitution. I got an influx of cherry angiomas over the past couple months everywhere, like all over my body. What do these usually mean? Some people say that it has to do with estrogen or like stress, metabolic stress. Some people say like it's blood sugar issues. So I'm honestly not exactly sure. I haven't been able to find like a definitive answer, but I do think it's possibly like either blood sugar or estrogen or possibly even iron. How long to be on a SIBO-CFO protocol, and what to take or do after to help reestablish flora? Well, like a typical functional medicine protocol, a lot of people will say like wipe everything out and then restore it with probiotics. And like I'm like, that's we don't live in a fanciful unicorn world. Like that, in theory that sounds great, but in reality that's not how it works. So I don't think we should look at it as like a SIBO-CFO protocol. Oftentimes we need to be working on multiple things simultaneously, working on the metabolism, working on eating regularly, balancing blood sugar, working on minerals, and then we may have to sometimes do some antibacterials alongside of that to keep bacteria under control. And as we begin to tolerate more and more foods, we add more and more foods in with a periodic break from antibacterials. But our goal is to get to a place where we have less and less symptoms. Sometimes we have to do I don't really think that it's a good idea to take like antibacterials or antimicrobials for more than like 4 to 6 weeks at a time. I think breaks should be taken. And then sometimes people need to repeat the cycle again. So they'll have to take antibacterials for 4 to 6 weeks, take a break for a week or two, and then redo. And some people have to do multiple rounds because they have such bad dysbiosis. And then once you're at the end, you need to evaluate do I even need probiotics, or is my gut doing really, really well? If there's still room for improvement, at that point, we really want to start to work on restoring things like stomach acid and bile flow, and then possibly considering probiotics. But I don't necessarily think probiotics are always a good idea, especially if someone still has really bad hypothyroidism and transit time is really, really slow. You're literally just going to re-implement bacteria right into the small intestine. And because your food is moving so slow, you're just going to create another overgrowth. So I'm very careful, and I encourage people to be very careful with probiotics. Hi, Jess. Thanks for doing these weekly. I'm wondering about your thoughts on Mitolife, Dissolvidol, and systemic enzymes in general. Where do you think it fits in with our FN journey? Yeah, I've used systemic enzymes for a really long time. I used them a long time ago when I was first really sick, and then I was introduced to them in my practice from a mentor who used them to break down biofilms in the gut. And so I personally think that it can be a great, it can be used for multiple different things, and people tend to use them for multiple different things. Some people just have general inflammation and tend to see a lot of results with that. Some people have scar tissue they like to break down, for example, a C-section scar. I've heard great reports on that. And that's what I've heard through the grapevine. I don't have personal experience with that. And then trying to think of what else. Oh, and then I like to use them to break down biofilms. This is why I think a lot of people can feel really sick when they first start to take them, is if you have really, really mature biofilms and then you take them and you break down the biofilms and fungus or bacteria or parasites are released, then you're not going to feel very good. So I think that they can fit in for some people. They just have to use it in their proper context. you do need to be careful with systemic enzymes. They can really thin the blood. So it's important to be like very cautious with them and like pay attention to that kind of stuff. So where they fit in, I think if they're like applicable and there's something that somebody wants to experiment with, and it's not going to interact with like anything they're taking or anything that like any medications are on, it just depends on like what goal you're trying to achieve. I personally don't just like take systemic enzymes like randomly long term. I don't really see a difference with them. I mean, yeah, I guess if you're gonna like use them to digest your food, but that's like a very expensive digestive enzyme. The whole purpose is to kind of take them on an empty stomach. So I personally don't like use them long term. I don't personally think that they're like something I would take on a regular basis. They're more something I would use as a tool. Can spore-based probiotics be taken during pregnancy? I can't say yes or no to that. I would either look on, either ask your healthcare provider or look on the bottle. You can call the company and see what they say. But yeah, I can't say like, yes, they can or no, they can't. And honestly, with a lot of supplements, there's just not enough research to make a definitive, a statement on that. Any ideas, thoughts why dysgeusia happens? Honestly, I'm not even sure what that is, but I'm definitely going to look that up. Yeah, I've never heard of that. Dysgeusia? Let me see. Sorry, I'm going to take a detour just now because I'm really curious. Oh, like an altered taste. Interesting. Yeah, I'm not sure. That is really interesting though. I wonder if it has something to do with like neurotransmitters or something like with the like that kind of gut-brain connection. Can you speak to causes of bad breath that's worse on an empty stomach? Usually this is a sign of like endotoxemia or like lots of endotoxins, bacterial overgrowth, fungal overgrowth. Yeah. That's usually because when the bugs aren't eating, they can sometimes really cause a lot of endotoxin issues. But yeah, that's not the only thing it could be, but a lot of times that's what it is. Do you recommend Vitex and maca for low progesterone? Been having terrible insomnia in the luteal phase now, have lots of gut issues too. I'm not sure where to start. Well, we need to get down to the root cause of our stress, because if we're just taking a Band-Aid, for example, we say like, oh, I'm going to take maca or Vitex to boost my progesterone. Well, that's great, but a lot of times they don't work because you're not getting to the root cause of the stress, which is therefore what's causing the low progesterone. So what we want to do is focus on the foundations first. If our gut's out of control or our nutrition is not on point, we're super stressed out, we're not sleeping well, we're over exercising or not moving at all, we need to work on the foundations. And then a lot of times things will take care of themselves. Like, it's not necessarily a great thing to have low progesterone, but those other things are even worse. So over time, our body will usually fix the low progesterone as we get to the root of the stressors. So we don't want to be doing quick fixes unless that's something that really makes sense for us. Does Jerrycare aspirin degrade DAO enzyme the way that Advil or ibuprofen does? I don't think so, because it's not a COX inhibitor like those, but I need to look into that a little bit more. And also, obviously, if we feel like our histamine issues are getting worse from taking something or doing something, we need to pay attention to that. Also, wondering your thoughts on healing hypothyroidism when medical results are always showing normal, but I am sure I have low thyroid. So a long time ago, this was considered like cellular hypothyroid. Hypothyroid was very rarely diagnosed using just blood test. Doctors were kind of under agreement that that was not like a great way to diagnose hypothyroidism, which is interesting now that it's used today. But they used to use different things like the temperatures. They would look at people's hair and skin. They would also use the Achilles tendon reflex. There were like multiple different things that they would use to kind of like check out metabolism levels. But usually when people have normal levels in the blood, they're often having a cellular issue, because remember, like, the blood is just, it's not where hormones end up. The blood is where hormones travel. It's a highway for hormones. And so we need to remember that that doesn't always reflect what's in the tissue or how our cells are responding to hormones or minerals or things like that. Can histamine symptoms be a sign of die-off? Recently changed to Bifido Maximus Probiotic and SF722, and I've noticed some histamine flare-ups after some foods. Sometimes it can be. Also, keep in mind that like if you're having, when you start to take anything that could be considered like antimicrobial, when you start to shift the microbiome, or you start to maybe sometimes what happens is you kind of like, I call it like a layering or like a waking up effect, where you may kill the top layer or start to move around the top layer. But then once you start to move around the top layer, it starts to move the second layer. And then, you know, you have this other like now almost new microbiome where you're now reacting to other things. Maybe you're not reacting to what you were previously, but now you have some other symptoms that have popped up. So whenever that's happening to either me or like a client, you know, you want to pay attention. You don't want to just be like, oh, it's fine, it's just die off. Like sometimes you need to make sure it is die off, because sometimes it just means like I'm not doing well, I'm getting worse. But oftentimes there is like an adjustment when you are shifting the microbiome. Oftentimes like it is a little bit uncomfortable, and with fungal issues specifically, they tend to get worse before they get better. But knowing that doesn't mean that it's like, oh, it's just die off and like I'm just gonna, you know, just count it off as that. Like it's a good idea to still pay attention. But yeah, I mean, it can definitely be for some people. What are these high quality specific probiotics for SIBO, SIFO treatments? I wouldn't call them treatments. I just think it's like everyone's very different with probiotics that work for them. But some people respond really well to like a spore-based probiotic. But you know, spore-based probiotics tend to be very antimicrobial. So some people actually get a lot of die-off with spore-based probiotics, or they find that there's shifts in the microbiome. They actually have to like really work on what's happening. Like I've heard of people getting starting to get those fungal infections after they take a spore-based probiotic, because certain bacteria were maybe keeping the fungus in check and it's not anymore. And so therefore now you got to deal with the fungal issues. So gut issues are very, very, I don't want to say complicated, but there's a lot of caveats to them. And so to say like things are cut and dry, it's just oversimplification or like fear mongering. And I don't like to do that. Sometimes we have to intuitively kind of like dig our way out of gut issues, and it can take some time. But probiotics that tend to be good are ones that are going to be native to our digestive tract. So they tend to be pretty expensive, or things that we would find in the soil, like obviously like a spore-based probiotic. I like just Thrive or Mega Spore-biotic. Environmedica sometimes works really well for people. Equilibrium can sometimes be beneficial for people. And then I really like a Bifido, like a broad spectrum Bifido, like Bifido Maximus in the Gut Institute, which I think in and of itself can cause a lot of like restructuring of the microbiome. So those are kind of some of my favorites, but that obviously doesn't mean that those will work well for you. And I think that there are a lot of like beneficial ones out there. And certain strains, like the strains are more important than the actual probiotic. I think like some people are like, they get caught on specific brands, and I'm like, well, the strains tend to actually be more important. Sorry, I need to wet my whistle. Starting out on eating pro-metabolic meals, but I find that I'm often hungry like 2 or 3 hours later. Is this normal? I have blood sugar dysregulation, so I don't want to restrict calories. Thank you so much. Some people, when they start to actually eat for their metabolism, they do find their hunger starts to pick up. But if you find yourself like getting hungry like really quickly or 2 hours after, you might be eating too much carbs for your body, or maybe not enough fat, or not enough protein. So it's really important to adjust and see what works best. But we want to be, after like 6 to 8 weeks or even like 12 weeks, we really want to see that our blood sugar is starting to balance out. If our blood sugar dysregulation is getting worse, then usually it's something that we're doing and not just like the shifts and changes that are happening. What would you take if you had Tenea versicolor? I would totally work on like antimicrobial stuff, like specifically fungal issues, because Tenea versicolor tends to have a lot of fungal connection. I've worked with quite a few women who have it, and most of them have some type of fungal issue. That's just from my observations. But yeah, I would be really working on fungal issues, like probably you guys know that I've talked about in lives of the past. I really like Biotic's research, FC-Cytal and Dysbiocide together. That's one of my favorites, but it doesn't work well for everyone. So again, there's like caveats to that. I really like Oreganol or P73 by North American Urban Spice Co. What else do I like? I like SF722. That's specifically an antifungal. It doesn't really work well on bacteria. Sometimes like black cumin seed oil can be very effective at breaking down biofilms for funguses. So even though it is like a PUFA, I don't really stress too much about PUFAs. Like it tends to be sometimes therapeutic in some gut stuff. Sometimes garlic can work really well, like allicin or just like crushed up garlic. So yeah, like different things that are just like antimicrobial, but everyone's a little different with what they respond to. Have you ever used bulk supplements brand of oyster extract? Doesn't look like there's any added zinc. Would there be something else I should look for? You know, that's interesting that you bring it up because every time I've searched, it's come up that it's oyster shell powder, and I didn't realize that they had an oyster extract powder. But I've never tried it, but if it doesn't have any additives, like why not? Sometimes I do call companies and I'll just say like, hey, where do you source your stuff from? Like, where do you get it? How's the processing? If sometimes they'll give you the information or they'll say like, hey, we'll send you a report. Sometimes they don't. And if they don't, or they're kind of shady about it, then sometimes I'm like, okay. But yeah, I mean, I personally have never used it. Does progesterone work for hair growth when used topically? Some people say yes. I've had some like good success with it. Sometimes it's hard to apply just because it is oily. So I have to only put it on like the day before I'm going to wash my hair. But a lot of people say that it is very effective. What do you think about the recommendations for the thing that's going around right now, the ascorbic acid and D3, and why they believe that works? I think that there are certain things that like can possibly work in the short term that maybe don't give you the benefits that you want in the long term. You know what I mean? Like, and we've seen like this again and again throughout history. It's like this hyper focusing on like, you know, a couple of different things. To work in the moment, to work therapeutically, but then everyone hops on the train and takes it long term, and then it causes all these problems. So that's kind of my thoughts behind it. Other than starting with looking at minerals and an HTMA for kidney stones, what else would you recommend doing to help with stones? I would be looking for fungal overgrowths. I would probably get an organic acids test to see if it has to do with oxalates, because you can easily see on an organic acids test your oxalate status. And a lot of people who have kidney stones like tend to not be breaking down oxalates very well, but then they go on a low oxalate diet and they don't see any improvements. And what people don't remember is that fungus and mold can actually create oxalates as well. And so if I was having like recurring kidney stones, I'd be looking at obviously like my calcium status, magnesium status, because sometimes people have calcium collecting in places because of the low magnesium. But then on the other hand, I would also be looking at oxalate status. Ever since adding in liver supportive bitters, my blood sugar seems to be all over the place again. Could there be a correlation? Yeah, for sure. Some of the bitters have heavy alcohol content, which some people don't respond to very well. Some people are doing a little bit too much. Some people's livers just need to adjust. Sometimes they do affect the liver's ability to store up sugar, so glycogen, which can obviously affect like how the blood sugar is going to regulate. So, you know, I always do like experiments where if something's affecting me, I'll take it out and I'll see if it goes back to normal. And then if it does, then I'll implement it slowly again and maybe do it in a small amount to kind of see what could be the factor. Is it the amount? Is it the time that I take it? Like those types of things. Hey Jess, what did you say about celery juice again? Like, why does it work for some people? It's really high in sodium and potassium, like minerals. And we need minerals to make stomach acid and then obviously to lower our stress. And so, you know, when people implement something and they think it's like, oh, it's the celery juice. And I'm like, oh, it's probably the minerals. And they think like, oh, celery juice is magical. And I'm like, no, minerals are magical. And you've just decided to get your potassium from celery juice, like a nasty celery juice. But for a lot of people who have like oxalate issues, for example, or some other issues like sensitivity to celery, it can be really problematic. So that's why it works. It's the minerals. Can you describe again why people feel nauseous and not hungry, low appetite? I saw it in your story the other day, but I forgot. It can be all different reasons, like liver issues, blood sugar issues. Like once our stress hormones kick in, it really suppresses a hormone called ghrelin, and ghrelin is our hunger hormone that our stomach secretes. And so once ghrelin is suppressed, we start eating ourselves instead. And that's usually why. Now, some people can lose their appetite from like endotoxin. They have really bad like bacterial overgrowth, and that endotoxin is really affecting their gut. Some people can lose their appetite if they have like gallbladder or liver stagnation. So there are like other reasons why, but it tends to be the stress response tends to be the biggest thing. How does one detox mold? Do you see mold being an issue a lot? Mold is definitely not my specialty, and I would actually recommend checking out PJ Harlow Wellness. That page has a lot of good info. And I think the thing is like, on the one hand, I see how humans have like coexisted with mold for a long time, right? Like we didn't used to always like sleep in these houses where, you know, everything was super sterile. We used to like sleep on the floor of caves, you know, where there's probably plenty of mold. However, like the mold growth that we're experiencing today could possibly be different. And I'll also like think about mold infestation in the walls or something like that with minimal ventilation, or like very noxious types of mold, like black mold. Of course, that's going to affect us. Like we're not breathing clean air, and there's tons of mold spores everywhere, and that's going to totally affect the fungus in the gut. So remember, we have fungal microbiomes on our skin, all our microbiomes, our gut microbiome, our vaginal microbiome, and the bacteria and fungus in our environment affect the microbiomes on our body and in our body. And so a lot of times when people are being exposed to lots of mold, their body's having to break down tons of mycotoxins or mold toxins. And mycotoxins are estrogenic. They're also like super hard for the body to break down. They require lots of minerals, lots of nutrients. They're very hard on the liver, so they're depleting us very quickly. So yeah, mold can be an issue a lot, especially if we are living in a mold infested house. But I have like a lot of people are very doom and gloom with mold. Like it's pretty much like you need to burn all your belongings. And I'm just like, that's like so like extreme. So I don't know what the answer is. I think like having a very balanced approach to mold, like some people I see just obsess about mold and they come to realize like mold wasn't even their problem. So I think like we should practice balance. If it's something that we can approach, if it's something that we can explore, it's probably a good idea to do so, especially if we suspect it. But it's not something that we should like be constantly consumed with. Hormonal cause of disproportionately large breasts. I don't know what you consider like disproportionately large. I think women like probably used to have much larger breasts than a lot of women do today. What's normal in our society is very different than what was normal a long time ago. Just look at like statues from a long time ago or paintings. Women tended to be very voluptuous, have very large breasts. So, you know, I think that hormones can definitely be the cause. But again, it's like disproportionately large. Like what are we basing that on? I think estrogen plays a large role in breast growth, though. I think you mentioned you did a salt scrub for your hair once. How do you do it? I literally just dump salt like on my head and then just like exfoliate my scalp. That's like literally it. I just bring like a big bowl of salt into the shower with me and just like sprinkle it on dry. Rub it. Not like vigorously, you don't want to like damage your follicles, but like exfoliate it and then just rinse it out. I know you mentioned this before, but what app do you use to track macros? I use an app called Cronometer, Cronometer. When would you say the best time to take DE is. Nutritionist recommended it to detox heavy metals, told me to take it in the AM and wait an hour, but I would like to eat breakfast sooner. Thank you. Just maybe at night, like right before we go to sleep. That's what I do with it, like when I'm taking it. The recommendation is like away from food, but I don't think like it needs to be that far. Is tanning bed better than a fake tan? I just wonder, like, what's the point of either? Like, I know some people that use a tanning bed for like other reasons, like to kind of push off the winter blues, get some UV light in really dark and cold places. But I personally wouldn't be baking in one of them to get enough to get tan. And fake tan is like pretty dangerous as well. Like, we need to like start embracing our natural skin color, I think. And also, like, if we work on our vitamin A status, this is where retinol can come into handy. If we have like adequate levels of vitamin A, oftentimes we can actually, we don't tend to burn as much in the sun, and we tend to usually get a much deeper tan. I hate reactions to almost every supplement. I have reactions, I'm assuming you meant. Thoughts on what causes this? What are the additives, or like where is your body at? I think like there are some people that are just such in an imbalanced place that their mineral status is sometimes so low that they need to go so slow. Like I'm talking about like a half a spray of magnesium oil on the bottom of their feet for a consistent period of time, and then work up to like one whole spray. A lot of people just like go all or nothing. Like they're like, oh my gosh, I just implemented all the supplements and then I reacted to them, so I stopped them, and then they do it again and they continue to have these reactions. So for some people, they're very sensitive because they're in such a depleted state that implementing stuff too quickly causes either like too harsh of a detox reaction or just too much of a reaction altogether. So I am a big proponent of choosing food first, getting your nutrition into place first, and then figuring out if you have something that's constantly adding to your burden. Like I know you had asked about mold. That's one thing that like a lot of people are reacting to because their liver's just so trashed, or when our gut's super imbalanced, like that can really affect it. So sometimes our liver is the culprit there. We're not reacting to things well because we're having such a harsh detox. For years, I've been told that dairy and meat is bad for endo. Is this true? I feel so much better with the energy I get from raw milk and good meat. I think you answered your own question, and I think you should trust your gut. You mentioned back knee can be gut parasite related. What kind of anti-parasite treatment gut protocol would you recommend to start with, or rotate a bunch of antifungals until it clears? Well, I can't recommend anything. Like I don't recommend. I think everyone's very different, and this is where it can be helpful to kind of see what we're struggling with. Like for parasite stuff, I really like just simple, like, clove, wormwood, those types of blends. I think BioRay has a good one. Like those are kind of like, those tend to work really well. But yeah, I can't say like what I would recommend. I think it just depends on what we're struggling with and kind of figuring that out. And if we're not going to go work with a practitioner or get tested, then sometimes that usually equals a lot more experimentation. What are your thoughts on ashwagandha, CBD, or hemp oil to lower stress? I think that CBD oil is really like a Band-Aid for magnesium deficiency. A lot of people are very deficient in magnesium. Like I'm talking so depleted. And certain things are kind of like a Band-Aid on that, make them feel a little bit better, but in reality aren't fixing anything. When it comes to ashwagandha, for some people it can work really well, and for some people it doesn't work at all. This is the case with adaptogens. Everyone is very different with adaptogens that work for them. So I think it just depends on the person. Can't wait to just buy your gut course. Yeah, I've been working on it. I'm trying to give you guys a different approach because there are a lot of people who have tried to resolve gut issues with like the regular functional medicine approach of just like kill and destroy and then like replenish with probiotics. But I see that these people tend to just like, they do it and then they are good for a period of time and then their gut kind of declines and then they have to do it again. And I'm like, this is obviously not working. So I think minerals actually are more important for gut health than anything else, calming the adrenals down and really working on that. And then sometimes, like I said, like implementing some strategic antimicrobials can help us feel better a lot quicker. Is Shilajit for everyone? I don't think any supplement is for everyone. Shilajit tends to work really well for a lot of people, but some people will react very strongly to it. Some people cannot tolerate it at all. So I would never say it's for everybody. What are your thoughts on smoothies as a full breakfast? If you do well on a liquid breakfast, then they might be fine, but most women do not do well on a liquid breakfast. A lot of times their temps go down, pulses go down, their body just is too cold afterwards. A lot of women need a meal for the first meal of the day, unless they're really like metabolically sound. Could you dive a little bit more into the copper IUD besides what's on your IG? What can one do to mitigate the effects? Can it harm the thyroid? Yeah, I definitely can do a lot more on that. I probably do like a whole YouTube video or maybe like an IGTV. Yeah, there are a lot of like fear mongers out there about the copper IUD. And I'm not going to say like it doesn't come with a trade-off, because it does. Like there is definitely a lot of women who have been affected by it. Yeah, I can definitely talk about that a little bit more. Hi, I asked an FN Live but didn't hear an answer. Any hesitations with eating raw liver? Was going to cut up some thawed frozen liver for bite-sized pills. How much to take per day? Less risky to cook. If you're worried about the risk, cook it. I personally make sure it stays frozen for about 2 weeks before eating it, like cutting it up and eating it raw. But yeah, some people, if you don't feel comfortable with it, you definitely shouldn't do it. But if you're completely comfortable with it, like I would still keep it frozen for a couple of weeks before defrosting it. Remember, there's like a whole sect of people that literally like eat raw meat, and most of them like look pretty healthy to me. So I personally don't stress too much about it, but you guys need to do what you're comfortable with and kind of trust your gut. Do you think who places the copper IUD affects whether or not can get embedded? Probably. I mean, I just think of it as like the uterus doesn't necessarily, or I should say the cervix really, like the body doesn't really want anything there. Like it's not meant to be there. And so, you know, that's going to, of course, affect possibly how it's moving, you know? So I don't know. I truly don't know, but I'm sure it does matter who places it. Anything you'd recommend to help the inflammation caused by a copper IUD? I don't know what you mean by inflammation. The whole point of the copper IUD is to cause inflammation, which is what prevents implantation into the uterus. So it causes like localized inflammation and stress. That's kind of the point of it. But overall, like I would be more concerned with just making sure my minerals stay balanced and it's not messing with my iron and copper. And I would be evaluating like my iron status with a full Monty iron panel probably every couple of months. Does breast tenderness always indicate estrogen dominance, even if you've been supporting detoxification and metabolic health? Not always. Sometimes people can have too much progesterone and it makes their nipples kind of puffy and tender. I find that it's like more like a nipple puffiness, I think. But some people say that like they have too much progesterone and their breasts get tender. But yeah, typically that's the symptom. But of course, you always like, if you're worried about it being something else, you definitely want to get that checked out. Is there anything that can replace coconut water nutritionally? There isn't much I don't like, but I can't stomach the taste. Well, what kind are you getting? I used to hate coconut, like anything coconut water, coconut, anything. And then over time, like I adjusted to the taste, but I would try different brands because all different brands taste different. And nothing tastes quite like the water straight from a coconut. But yeah, nothing really replaces it on a nutritional level. Like it really is unmatched by anything else. What do you think about Kodiak pancake mix from Costco? I don't know. Did you check the ingredients? I personally don't eat a lot of like wheat, so I'm not like super up on the wheat containing foods. But if the ingredient levels look good, like why the heck not? What tips would you give to men? Anything in specific you think most of them should be focusing on? I think most of them should be focusing on most everything I talk about on Instagram. I just personally have a business that's focused on women, but Fully Nourished pretty much applies to both men and women. It's just the cycle stuff obviously doesn't, but really the cycle stuff is only one lesson. So a lot of times people just don't realize, but like men are much more resilient to stress because they don't have as much estrogen. So they tend to have a higher threshold for just stress in general. Like they'll tend to push their bodies a lot more without seeing symptoms. They might see symptoms like small symptoms, but they won't see large stuff until later on. But yeah, men need to be eating more calories than women do. They need to be eating the same types of nutrients and in quite abundance. They need to be sleeping. Like all those things totally impact men as well. What are your thoughts on parasite cleanses? I know some people swear by doing them annually. Do you think that's necessary? If you're continually iron overloaded, you're going to continue to feed parasites and they're going to continue to come back. I personally think that parasite cleanses sometimes are a Band-Aid. I mean, I don't think they hurt, honestly. Like, I'll be honest. But I don't necessarily think they're like an end-all be-all either. What about alkaline and electrolyte water? Well, those are two different things. Alkaline water is alkalinized, meaning that its pH is alkaline. And remember that most water, including like natural water we would find in a spring, is not alkaline. It is slightly acidic. Water should be slightly acidic. If you drink a bunch of alkaline water and your whole digestive system is supposed to be acidic, think about how hard it is for your body to actually get back to its acidic state. Electrolyte water, different. I mean, electrolytes are important for our body. Those are minerals. Any good books you know that would help educate on children's health or getting to the root cause of possible gut problems with them? I mean, anything applies. We have to remember that we are the ones that pass our microbiome to them. So, you know, when your child passes through the vaginal canal, and then, you know, obviously our breast microbiome also is going to impact them as well. So those are factors. So oftentimes their gut problems tend to be pretty similar to ours. Especially if we had like a messed up gut before getting pregnant with them or while pregnant. So that's like kind of the first step. But really like everything that applies to adults applies to children. It's just on a much smaller scale. Like we have to be a little bit more gentle with their bodies and like careful with their bodies. Like I personally wouldn't do like any invasive antimicrobials or things like that. Like I would be much more focused on trying to gently restructure using nutrition and maybe like some high quality probiotics. What could cause a short period? They used to be 5 days of bleeding, but this month in my luteal phase, I had some estrogen detox symptoms and now I'm constipated. My period was only 1 day long. Some people, like, I don't know what you're supplementing. Like, are you supplementing progesterone? Some people are supplementing too much progesterone or they shouldn't be supplementing progesterone and they are, and they're creating like really light cycles. Do you know if you ovulated or not? Like, I'd be paying attention to like if I ovulated. Yeah, I mean, is it spotting? Like, sometimes periods do kind of get out of whack, but we just kind of need to pay attention to like the long term. What do you think of Dr. Nicker using VC and watermelon juice? I don't know anything about him, but yeah, watermelon juice is great. Where would be a good place to go for hair mineral analysis tests? Is this something that I should do to check my levels before copper IUD? I personally like to order mine through evenbetternowhealth.com. I always hear people talking about detox pathways being blocked. Is this a real thing? It's not really about being blocked. It's more about having the right nutrients to go through that pathway. So each different detox pathways have different needs for certain nutrients. And so if we're depleted in those nutrients, those pathways may be impaired. They're not blocked, they're impaired. Yeah, and this idea of like opening up our detox pathways, like they're always open. I guess we could do a little bit more to support them, but I don't like this idea of them being blocked. Like that's a little not scientific. Is brown rice or quinoa difficult to digest? I don't know, Megan. Is it difficult to digest for you? Everyone's different, you guys. If you like a food, don't ask me if you can eat it. Ask your body if you can eat it. Hi, I've been having spotting mid-cycle. It's been brownish reddish. I seem to have this often. This time it's lasting 4 days so far. It started day 13. My cycles have been 31 days long in the past several cycles. I've also been having thick, dark, rust red discharge the past several days too, which is new. Kind of has the same appearance as clots, but I'm sure it's discharge. What could be going on with this? That's not a question for me. That's definitely a question for your doctor. I don't know like anything about you or your history or anything like that. Some people are experiencing like cycle changes from all different types of, lifestyle stressors, nutritional stressors. Sometimes we're implementing things that are helping us, balance our cycle. Sometimes we're getting our cycle back, and so it looks different. But yeah, that's definitely not something that I can answer here. Would you take ancestral supplements, gallbladder supplement, if you were pregnant? My gallbladder has been bugging me. Yeah, I mean, I wouldn't stress too much about it. But the guy that owns that company is very, very helpful. So you should just reach out and shoot him a quick email. Just got vitamin E today. Is it recommended for long-term because PUFAs are all over? I wouldn't say it's recommended for long-term. I personally don't take it as much anymore. I take it like a couple times a week. I don't take it every day like I used to, but everyone's different. Like, I think it really depends on our history and all different types of things. Like, we need to take our own health journey into context. I was hunting in New York when I suddenly became violently ill. How do I stop New York hunts from becoming overbearing? What? Okay. When you talk about liver, is it chicken or beef? Usually beef liver, but some people will only get chicken liver. Been nourishing 6 months, and I notice I've been freckling in the sun. Is there anything I could do to support myself when I'm in the sun? Do you think it could be a years-long process to get PUFAs out? I think it can, and I think some people just need more vitamin A. Yeah, I do think like we need to make sure that we're getting the right nutrients in our diet. And sometimes if we're worried about like an iron issue or a PUFA issue, it's sometimes a good idea to get a full Monty iron panel done, because then we can actually see like where our vitamin A levels are at, and also like where our iron and copper balance is. Do you take trace minerals regularly? Yeah, off and on. I do like a jigsaw adrenal cocktail every morning and afternoon. I do lots of orange juice with salt in it and coconut water. Sometimes I need the added minerals, so I do. Well, I will add them. What will deplete K2? Excess calcium, vitamin E. Yeah, I mean, all fat-soluble vitamins work in conjunction with one another. So if we're taking too much of one and not enough of the other, we can definitely deplete. Excess calcium, definitely, especially if it's like non-organic calcium. And just overall, like, not getting enough. Like, we're going to use it on a regular basis. It's a nutrient that we regularly use. So if we're, not using it, then, or if we're using it and we're not intaking it, then that can be a problem. Hi, Jessica. Favorite ways to get in vitamin B6 specifically? Liver, beef, like just regular beef, and some really well-cooked greens or greens broths. Like just a variety of vegetables. Sometimes like pressure cooked beans can be a good source for people that can digest them okay. And bee pollen. And then of course like brewer's yeast or nutritional yeast. Weather went from 70 to 20 in 2 days, got stuffed up nose and chapped lips. Tips. I think sometimes like that's just our body's response to the dramatic change in weather. I would be like maybe gua shawing my sinuses or something like that. Why do I get bloated after finishing up my menstruation? Some people, when their estrogen starts to rise, like their digestion starts to slow down. What's your take on sexual stimulation causing early ovulation? I mean, it's totally possible, but I don't know. I haven't looked into it enough. Do you recommend Ona's progesterone oil or cream? Is the cream PUFA free? I don't know. Why don't you look on the label and check if the ingredients are up to your par? And when it comes to Ona's progesterone oil or cream, like I don't recommend them or not recommend them. I think everyone's different, and like being educated about bioidentical progesterone is important, but do I think it's right for everyone? No. Is any brand blue light glasses okay? No. Remember, like the more clear blue light glasses are not going to be sufficient for blocking all blue light. I like to wear them during the day, but I don't wear them at night because they don't block enough blue light. Can progesterone aromatize anywhere in the body? Could it convert to estrogen after applying it to the skin? Possibly. A lot of time aromatase is in the liver. So things get changed to other hormones in the liver. That happens mostly in the liver and the gut. So I don't believe that it can just turn into estrogen anywhere. I do think that some people can oversaturate their tissues with progesterone, and that can be a problem. This is why I always recommend people be very careful with progesterone, because it's not always working for them. And if you're like constantly trying to guess, sometimes just testing can be very helpful to see where we're at. What are your thoughts on intralipid infusions? My doctor is recommending I have one. I'm not familiar with that. Are your percentages on Chronometer app accurate? Not all of them. I think they're just going by the RDA. I go in and set my own sometimes. Of all the tests out there, which one would you recommend to anyone feeling fatigued constantly? I don't know. I would have to see like what somebody's problem is. For example, like if they're feeling fatigued and their gut's really messed up, they need a gut test. If they're feeling fatigued and they're post-pregnancy, they need a mineral test. So it really just depends on like what's left them where they're at and where they're trying to go. What are liposomal supplements and are they bad? I've heard a lot negativity, and then I saw them for sale in my chiropractor's office. Honestly, I'm not really sure. They say that they're just better absorbed and more bioavailable. I just think they're a big scam. But yeah, I don't really know exactly. I think liposomal actually means it's a little bit more like smaller particles, I think, and which I'm like, that's what would make me nervous. What can a typical blood test show you? I don't know. It depends on what kind of blood test you're getting run. Thoughts on Noel's Thyro Plus? I feel like it made me break out even more. Not sure if I should continue to take it. I've been eating Pro-metabolic for about 4 months. I'm not sure. I think it has like, let me see. I think it has like oyster powder, ashwagandha, pearl powder. Like I don't know. I'm not that familiar with it. People ask me about it all the time, and I'm like, I don't like taking blends of things because I can't control what's in them. And then I don't know what I'm reacting to. Like, how do we know which thing caused the breakouts? How do we know if it's like detoxification or if it's something else? Because we don't. We've just took like 8 different ingredients or whatever. Let me see. What are the ingredients in it? Let's see. Ashwagandha, oyster extract, magnesium glycinate, glycine, calcium carbonate, niacinamide, vitamin P6, P5P, biotin. Well, yeah, biotin can definitely make you break out. Synthetic B vitamins oftentimes make people break out. Not always, but sometimes. I see new stretch marks slowly forming on my upper arms in the last couple weeks. What might I be missing nutritionally while I gain safety weight? What can I do to support my body? Anything topical? I would really be looking into my vitamin A status, my retinol status. Yeah, that's really important. Like a retinol blood test can be very helpful. And I usually run a full Monty iron panel on myself with retinol or vitamin A that I buy on requestatest.com. But yeah, I like to see my retinol like towards 70 at least, because yeah, I want a good vitamin A status. It's going to help me move iron and get bioavailable copper up. And usually like it can, yeah, it can usually help with stretch marks in some people. Any opinions on the root cause clinic service? Root cause clinic. I'm not sure. I'm not that familiar with them. You've mentioned that antibiotics create space and you need to be mindful about what you're eating to fill up that space. What are some examples of the things to eat to repopulate good bacteria after antibiotics? Well, it's also fungus you have to keep in mind, because when you take antibiotics, you're not doing anything to fungus, but you are killing bacteria. So that's another thing to kind of keep in mind. But I would just be eating my regular diet. Make sure I'm eating like some well-cooked leafy greens, carrots, a wide variety of root vegetables, beets, parsnips, cassava, all different types of like starchy root vegetables, possibly grains if I do okay on grains. And then, yeah, like just regular protein and high quality fats. Is tahini high in PUFAs? Yeah, I think sesame seeds are pretty high. But again, guys, weigh the benefits and the cons. Like, do you like tahini? Do you enjoy it? Is it a high quality version of it? possibly if you're not going to like pound the tahini, it's probably okay part of your diet as a whole. You know what I mean? What would you recommend doing to support your gut after a bout of food poisoning? I personally just take activated charcoal until I get back to normal, but that's just me. Do you have any ideas why I could be growing new baby hairs, but also shedding a lot of regular full-length hair at the same time? So weird. How's your energy levels like in regards to iron and copper status? How are your fat-soluble vitamin intake, like vitamins A, D, E, and K? Yeah, because sometimes we can grow hair really fast, but our hair can be weak. I think you've mentioned before that you can test your vitamin A levels pretty easily. Do you know what that test would be called, how to get one done? It's vitamin A or retinol. You can ask your doctor for it. There are a lot of like over-the-counter testings as well. Any recommendations for a full thyroid panel you could order to have done if your doctor isn't willing to get one for you? I've heard of Everywell, but it doesn't look like they offer a full panel. I really like Life Extension. It's a really great resource. Let's see. I lost myself for a second. All right, guys, I'm going to give it like 10 more minutes. I'm going to try to get through as many as I possibly can because then I have to go eat dinner. Favorite brand of antimicrobials? It just depends. Like I use all types of antimicrobials, like Crucial 4. I really like their olive leaf extract. I like Biotics Research, like FC-Cytal, Dysbiocide. I like all different types of brands. It's not really about the brand. It's more about the effectiveness. Hi, Jessica. Can you think of a reason my cycles have gone from 28 days to 34 days? I don't have any extra information. I have no clue. Are you stressed? Are you ovulating later than normal? Like, what are the possible stressors that could be pushing our cycles later? Because usually it's not that we're having a later period, it's that we're having a later ovulation. So that's where tracking our ovulation can be very helpful. Thoughts on aspirin during gut healing? Just depends on the person. Some people really love it. Some people hate it. Can antihistamines affect ovulation? I'm trying to wean off Zyrtec, and I also have my first anovulatory cycle ever this month. Very strange. I can't wait to have this drug out of my system. I've heard that as a possibility for sure. All types of like over-the-counter medications. You mentioned starting the book, Facial Diagnosis of Cell Salt Deficiencies. What did you think of it? I'm interested in pinpointing some mineral issues and looking to read deeper. It was interesting. Like I don't put like too much stock in it, but it was like an interesting resource to look at, and definitely like some good information specifically about like magnesium and potassium and stuff like that. Would a fecal implant from the fresh stool of a vaginally delivered child be beneficial? I'm ready to get extreme to fix my freaking gut. I've heard great things. I personally have I don't have experience with it, but I have heard things from clients and other people that use it. What's the difference between protein powder and collagen? Which is better? They're different. Collagen is supplemental. It's not a complete protein. Protein powder helps you get in more protein and is usually a complete protein. Have you heard of Mount Capra grass-fed goat whey? The goat whey, yes. And I like the goat mineral whey as well. When you say eat every 2 to 3 hours, you mean not to eat in between, and I totally do, LOL. Yeah, exactly. If we're grazing all day, our meals are not working for us. We need to really adjust the amount and usually the balance between the 3 different macros. Is there anything I should do to support my body during a hot flash? I'm pretty sure I'm mobilizing estrogen in those moments. I feel like my body is asking for something, but I don't know. I personally focus very much on minerals when I'm having an adrenaline response. So coconut water, like sodium, just all those types of things, like really making sure I'm getting plenty of minerals. And sugar, like carbohydrate, like a glass of orange juice or something. Hi there, strength training. Is there a rep range that you typically like to use? I know strength is usually between 3 to 5 and hypertrophy is closer to 8 to 10. Is this correct? Yeah, and there are caveats to both. Like I think that if you're trying to build strength and you're trying to also, build muscle, the two are not exclusive. You should probably be doing both. And a good strength training program actually includes different types of things. So usually for your compound lifts, like deadlifts, for example, you're going to probably go a little heavier and you're going to be more in like the 3 to 5 rep range if that's what you like. I personally rarely do lifts unless I'm maybe just going for like a PR, just trying to see like what I can lift, but very rarely do I like to put that amount of stress on my body. I'm usually keeping my rep range in between 12 to 15. And then like for maybe some heavier lifts, 8 to 12. That's kind of like my sweet spot. I just got an air fryer. What kind of oil do you use in yours? I just usually melt ghee. And sometimes I'll use MCT oil if I'm lazy. On chronometer, and like people will say like, don't use ghee or don't use coconut oil or don't use butter. And I'm like, I'm going to melt this stuff and it's going to look exactly like oil. On chronometer, my vitamins and minerals are great daily besides D and K, even though I eat tons of dairy. What can I do? I don't really stress about stuff like that. I just make sure to get enough. Do you wear sunscreen? No. I almost feel like I need to wear like sunscreen when I'm doing like, I have lights right now. Cause like I start to get like kind of a little bit red. And, I do think that those have like more of an impact on my skin than like the sun does. But I know that Cosma Beauty really likes Pipette brand. Pipette, I think it's called. But personally, I don't wear sunscreen. I'm taking a break from Femara. Don't love the side effects. Any suggestions on how to balance my irregular period aside from basic nourishment and stress reduction? I would start tracking my cycles first. I think tracking patterns is really helpful because we can start to pinpoint when our body is the most stressed, and then we can start to actually adjust. And so that would mean taking our temps every day and like really starting to see where our stress is concentrated. And I know it can be annoying to take temps and pulses, but just commit to doing it for 30 days and see and start to work on pinpointing where your stressors are coming from. Hi, hope you're well. So I've had severe constipation for many years. I'm working on healing my SIBO candida overgrowth. Colonics have been working well once a week to help. Thoughts on colonics? I mean, they're a Band-Aid. They help kind of clear the bowels, but they don't actually do anything. Half persistent cystic acne for 20 years. Been eating FN for 1 year. Did a round of antibacterials a few months back after working with you, but still really struggling. Should I continue with what I'm doing and give it more time, or is it time to think about what may not be working? It might be time to adjust and see. So let's say, for example, dairy. See if dairy is working or not working for you. How are you doing with the raw carrot salad? Are you finding the amount of fiber that works for you? Are you being pretty good about getting nutrient-dense foods in, or do you have a lot of refined carbohydrates slip in? I think sometimes people, when they go fully nourished, they get permission from me to eat whatever they want, which is great. However, a lot of times foods that we've been really trying to avoid or restricting start to sneak in, which is great. It's important to give ourselves permission. But then over time, as we try to achieve our goals, we're trying to figure out like what's going on, what's wrong. And sometimes like a lot of things are slipping in that we're not really actually realizing. And so always going back to our whole food roots and making sure that if we are struggling, first and foremost, there's not a lot of processed packaged stuff leaking into our diet. We're getting our carbs mostly from roots and fruits and then properly prepared like grains, sometimes beans. I think that is going to usually be the most important change that we can make. Give me 1 second. I just have to do something really quick. Sorry, one of my team members is trying to log into something and they sent me a text message. My toes get super cold while doing low impact workouts such as Pilates. What would be the cause of this? If we're getting really cold, sometimes workouts mean during workouts, that usually means the workout is inducing a stress response. Sometimes it just is a problem with our fueling around the workout. We need to fuel better around the workout or leading up to the workout. Sometimes we need to change the time of the workout. Sometimes we need to fuel differently during the workout, but sometimes it's just that the workout's not working for us. Since adding in more carbs, fruits, I've had candida overgrowth. Thoughts on sugar with yeast infections? If you haven't watched my IGTV video on candida, you might find it really helpful, but I think it's just important to kind of find a balance there. When it comes to keeping yeast in check, it takes a good amount of copper and other minerals as well. And so if we're struggling with mineral imbalances, our metabolism is shot, a lot of times candida and other bacteria can kind of like have a party, and it really like the carbs are maybe expressing the issue, but the issue is always there. It's just now being expressed. Why do you think it's best not to follow antibiotics with probiotics? Mostly just from the research I've read that it actually can sometimes cause more dysbiosis for people. Anything that can help enamel erosion? What could cause it? Teeth are very sensitive to cold. Never had an issue, and I won't lie, I'm freaking out about it. Would brushing after every meal help? Sometimes brushing is, I think, like kind of abrasive. Personally, I always rinse my mouth out after every meal or juice or anything like that. I'm always rinsing my mouth out with water. And then I'm paying attention to my fat-soluble vitamin intake. I'm consciously trying to get vitamins A and E and K in regularly, minerals. But what did you change? Like, those are all things, like, I don't know enough to answer your question, but like, what would help? Well, what have you changed and where were you before? And hormones can also affect our mouth health. So did you add any hormones in or anything like that? Can progesterone cream oil help stop spotting? If so, would I just do a higher dose? I'm going on 2 months of spotting. I go to the doctor soon, but I'm so over it. Yeah, it's good to go to the doctor and get everything checked out. To say, like, can progesterone cream do that or not? I think everyone's going to be different. Started waking up with a swollen face and eyelids after rounds of antibacterials. Never had allergies before. Now I'm having allergies every day. Any tips diet-wise to fix this? Well, what did you take? Like, how high dose did you go? And then, like, sometimes it takes restoring bacteria. So sometimes doing some bites of sauerkraut or some fermented foods, trying to find the bacteria to help kind of shift the microbiome. But I don't know enough to know why. But figuring out why it's happening in the first place is usually a good idea. Usually that's a histamine reaction or something like allergy related. A lot of the time, the best quality milk I can get is grass-fed, but still has added vitamin A and hormone D. Would you suggest avoiding it completely? I crave milk a lot. I would just decide if my body doesn't do well with it, I wouldn't do it. If my body does well with it, I would do it. How to help PMS symptoms like not sleeping? Make sure we're balancing blood sugar throughout the day. Oftentimes what we're doing that during the day is affecting us at night. Since starting my pro-metabolic journey, my cellulite from before quickly came back on my legs, but when I put on some weight. Will this get better as I heal my hormone? It runs in the family. Yeah, I think that cellulite is something that a lot of times, like, is a little bit genetic, but for me, the only thing that gets rid of my cellulite is when I strength train. When I lift weights and build muscle, like, my cellulite goes away. But that's like, and working like body brushing, like moving the lymph system works for me. I love your weight loss gain Instagram videos. What stage of life are you in now and how are you approaching that? I personally don't like to go into deficits. I prefer to lose weight the long way. I educate on it because I want women to know how to approach it, but I personally don't do deficits. I don't do well in them. I prefer to strength train really hard, push my body in the gym, and fuel for that, and focus on my sleep, focus on my stress, and like really work on like minerals and things like that. Usually when you get to, like, for example, for me, I gained 15 pounds in the past like year and a half. And I got here because I was super stressed out. I was sitting too much. I was probably not focusing on my sleep as well as I could be. I was depleting my minerals, probably drinking way too much coffee, and not balancing my blood sugar or eating enough protein. So here I am, you know, all these factors contributed. And what do I prefer, to cut my calories and create a deficit to lose the fat fast? Or do I start to slowly reverse all these habits and do it consistently, all the while strength training, and then just give it time? And so I'm personally in a place where I am starting to like really build muscle and take training very seriously, get back my flexibility and my strength, and fuel accordingly. And the goal is some fat loss, but I'm going to give it some time. And I'm going to kind of document my journey a little bit on YouTube for you guys. I'm 9 months pregnant and having horrible restless legs at night. I take Epsom salt baths and take magnesium. Any other advice? Thanks, Jess. I'd be looking at all minerals, so like sodium and potassium as well. Like I would be looking at magnesium. But that is interesting. Like, that's a lot of magnesium. All right, guys, I'm going to do 3 more. What could be a reason why eating plant-based helped bad period cramps? My period cramps were much better when I avoided animal foods, except I was starving. Because if we're not digesting a food well, it doesn't have to do with the food. It has to do with our gut and our digestive system. And so we need to actually work on digesting the food better rather than just blaming the food. Because digestion is definitely going to affect our period. Hi, is there consequences of LASIK eye surgery? I don't know. I've been definitely looking into it because I was interested in doing it for myself, but I am like fearful at the same time. So I haven't been able to find anything like on the hormonal aspect or anything like that, but I am curious. About how long does it take to start noticing real changes after going pro-metabolic? It's been 9 months and I'm finally sleeping hours at night. Was mega insomniac and so relaxed now, sleeping 8 hours. How long does it take is a question I feel like you guys ask me a lot, and it's just not a easy question to answer because how long have you been in a messed up place? Like everyone's coming into this journey at a different state of depletion, at a different state of imbalance. Some people have tons and tons of imbalances. They have fungal overgrowth and iron overload and copper deficiency and all their minerals are depleted and, they're not sleeping well and they're this and they're that and they're this and they're that. They're 4 pregnancies in, everyone's so different. And so it's like, it's going to be dependent on all those factors. So it's hard to say, like, how long is it going to take? I don't know. Everyone's so different. Some people really take to it very quickly, and some people really need to offer their body a lot more support. All right, you guys, thank you so much for joining me. I'm sorry I couldn't get to all your questions today. I will resume next week on Wednesday, and stay tuned. We're going to be announcing like things in the next couple of weeks, a different way to get more involved in the community and maybe get more of your questions answered. So stay tuned for that and keep an eye out, but I'll see you next Wednesday.